Hello, and welcome to the Employee Benefits Enrollment for Scope Management Solutions. My name is Brent Young. I will be guiding you through this if you're watching it online. This benefit guide should have already been emailed to you by Melissa at Scope. And so this is just an online tutorial to go through the benefits guide. As you probably are aware, open enrollment begins on April 1st. Our deadline to have all of your forms in, I believe, is going to be April 7th. Please, please, please try as hard as you can to get your completed enrollment form to Melissa by the deadline. There are going to be some changes this year. We are staying with all of the same carriers, but the plan options have changed. So let's get started. So in this booklet, you're going to find information on how to enroll, the contact information, which is either going to be myself, Melissa, or Kim Lauderdale at my office. It'll go over the brief plan descriptions and all enrollment applications. If you are a full-time employee at Scope Management, you are eligible for an open enrollment. If you are a new hire, you have a 60-day waiting period. But if you have waived before and now would like to get on to these benefits, now is the time. Here are all of the contact information for you, and please keep these booklets and give them to your spouse as well, just so they have access not only to the carrier information but to our information. Like I said, Melissa is going to be your contact at Scope if you have any questions, but you can always contact myself or Kim Lauderdale at the Freeman Agency. You can see my email address and Kim's as well as Melissa's here on the guide. United Healthcare is still going to be your medical carrier. Your dental carrier is through Assurant Employee Benefits. Remember that Assurant does not use ID cards, so if you need access to care, it would just be your group number and your social security number. We can access and have that information for you if necessary. Vision is through United Healthcare. It's the same card as your medical card. And there's also basic life, AD&D, and disability that is it is handled and company sponsored by Unum. This is just more of the information on how you can be eligible. Feel free to look through it. Please note that your deductions for everything besides the life insurance and the disability can be done on a pre-tax basis. It's used through our Section 125 or cafeteria plan. So these premiums are taken out before taxes are taken out on your paycheck. So it saves you about 7.5% or so. Like I said, the medical benefits are going to be administered by United Healthcare. You have a PPO program available to you. That means you can go in the network or outside the network. When you stay inside the network, it's kind of like having a 50% coupon, especially for hospitalization, because United Healthcare is going to the providers and negotiating a lot of discounted rates. But should you decide to go outside of the network, there are some plans that are available for you to where you can go outside of the network and just pay whatever that doctor is charging and go towards your out-of-network deductible. One of the things that I want to talk about, and it's a new offer for Scope employees, is a high deductible health plan and a health savings account. I'm sure that you have heard of these. They've been around for quite some time, since 2001. And what this allows you to do is to put money aside for qualified medical expenses. It's a little bit different. And the way that I like to explain it is that there are two sides to an HSA. One is the benefit side, and the other is the tax saving side. The benefit side, you have to have a high deductible health plan, and you cannot have what is called a first dollar benefit. The first dollar benefit means that it's essentially a copay. So typically when you go to the doctor now, you have a copay, whether it's $30, $40, $50, and you pay that and the insurance company pays the rest. You also have a deductible for hospitalization. In a high deductible health plan, everything goes towards your deductible. So if that deductible is a $5,000 deductible and you have a diagnosis to go see your cardiologist, and that cardiologist charges you $150, you will pay that $150, and that $150 will go towards your deductible. Now, what is good about having a high deductible health plan is that it allows you to save money, which will be in addition to the premiums that are going to be listed, but it will allow you to save money to pay for those qualified medical expenses. And it's also done on a pre-tax basis. So let's say, for an example, you wanted to put in the maximum contribution limit of $3,350 as an employee. You can divide that by paycheck. You can make that a one-time lump sum, or you can just decide to put in $50 at a time. And so if I put in that a maximum $3,350, every time I go to the doctor, I am paying with free tax money. So that money is not taxed at all. This is also different than a HRA account, to where those premiums, or I should say those contributions that you make, should you not use them, they will roll over. There is no use it or lose it. It's a very good way to essentially hide money from the IRS, even though you're not hiding it, because it's legal. So it's a way for you to pay for your qualified medical expenses and not have to pay taxes on those dollars. Remember, every time that you do pay a copay, you've already paid taxes because that's your cash. There will be more additional information that will be sent to you should you be interested in the HSA. So let's talk about the plans. So these plans kind of go together. One is an HSA, you can see, and the other one is an EPO. Neither of these do have out-of-network benefits. They both have a $5,000 deductible, or it's a $10,000 deductible for your family. That would be $5,000 per person. You also have an out-of-pocket maximum of $6,000 on the HSA plan, or $6,350 on the EPO plan. Now, I mentioned the HSA. And it is going to pay 100% after your $5,000 deductible. So once you've reached $5,000, the plan is going to pay 100%. But all of your charges are going to go towards that $5,000 deductible, including your prescription charges. So if you have a prescription that costs $500 a month, you will be paying that $500 a month, and it is going to go towards your $5,000 deductible. After you reach your $5,000 deductible on the HSA plan, there is a drug card, and you can see there's specialty or there's just regular. So it's $10 for Tier 1. Tier 2, it's $35. A specialty is a $100 copay. And Tier 3 specialty is $60 or $300. Once you have met $6,000 total out of pocket, this plan will pay 100% total. Now, the reason why we compare these plans next to each other is that you can see the EPO plan here has a copay for going to the doctor. There are different kinds of doctors that you can go to. There's your primary care physician or a family practice doctor. It's going to be $35. There's also specialist physicians, and these are physicians that are in the network and they are specialists, and they will give you a little bit of a discount for using those doctors as opposed to other specialists. And then there's also a $70 for a specialist should you not be a preferred specialist through United Healthcare. After the $5,000 deductible on the EPO plan, the plan pays 80%, and you would pay 20% to your maximum out of pocket of $6,350. There are also copays for the drugs on this plan. And since this is an ACA eligible plan, everything goes towards your out-of-pocket costs, including copayments. So on this plan, the most that you would pay for the entire calendar year, including copays, is $6,350. The difference is the HSA, everything goes towards your out-of-pocket cost, and it is pre-tax. The copays and deductibles for the EPO plan is not pre-tax. You can see here are the employee cost per pay period, and you can also see the difference between having a copay at $90.91 per paycheck and not having a copay, and it saves you about $30. Should you be interested in the HSA, one thing that I do recommend to clients is that if you have budgeted for the $90.91, that's essentially almost one doctor's visit per year or per month. You could essentially take that extra $30 and put that into your health savings account, and at the end of the day, if you don't go to the doctor that month, you've actually made some money. The family cost is obviously a larger savings. So I would recommend doing a little bit of homework. You can log into myuhc.com, see exactly how much money you did spend on healthcare last year, and then make an educated, qualified decision for yourself. Here's another HSA option, and this one's got a lower deductible. It's a $3,000 deductible as opposed to a $5,000 deductible. As you know, as your deductibles go down, your premiums go up. This is also matched with a PPO network that does have an out-of-network capability. So this is a lower deductible at $3,000, but you also have an out-of-network option should you have surgery or go to a provider that does not take any type of insurance. So this HSA plan is going to work exactly like the other HSA plan, except your deductible is lower. It's still going to pay 100% after you meet your $3,000 deductible now, and you still have your co-payments for your drug card after you meet that $3,000 deductible to your total out-of-pocket maximum of $4,000. This plan does not have out-of-network benefits. On the PPO side, there is a copay, and that specialist copay is going to work exactly like the one we talked about before. So if you go see a specialist and it's a preferred specialist, you're only going to pay the $30. Should you go see a specialist that is a non-preferred specialist, your copayment will be $60. And that is all for in-network benefits. The same thing is going to work on the drug card, whether it's a Tier 1 or a Tier 2 or Tier 3, or whether it's a Tier 1, Tier 2, 3 specialty drug. And you can see the costs here per paycheck. So the cost difference between these two HSAs, you can do that budget and find that out and see what's best for you and your family. Moving along, let's talk about the dental benefits. The dental benefit is still administered by Assurant. Nice little link here that you can call or click on Assurant Employee Benefits to access your card. You can always regenerate one and just print it out. Or a lot of people just put it in their smartphone and show it to their dentist when they go to the dentist. The payroll deductions are listed down here below. But the way that this plan works is that your preventative services, so that's your routine cleanings and your exams and x-rays, are going to be paid at 100%. You do not have a deductible. You will the plan will pay 100% of the reasonable and customary charges. Should you have a problem, a cavity, or something fairly routine, you have a $50 deductible, and then the plan is going to pay 80%, and you will pay 20% to a maximum of $1,250. Now, it works different than medical. So the maximum that Assurant Employee Benefits will pay in a calendar year is $1,250. Major dental services is a 50-50 split. So if you go get a crown, let's say it's $850 total for the crown, you're going to pay your $50 deductible, and then Assurant would pay $400, and you would pay $400. I think I did my math correctly. You also have orthodontia. This is for your children, and it is up to age 19, and it will pay a lifetime maximum of $1,000. If you've already used an orthodontia benefit on your child prior to employment with Scope or through another carrier, you've already reached that lifetime maximum. But if not, then your child has access to $1,000 off of their braces. Let's talk about vision. Vision benefits is administered through United Healthcare. Your eye exam, you're allowed to go once every 12 months, and you're going to pay a $10 copay. Your materials, or frames or lenses, is also a $10 copay. And your lenses is a $10 copay. And you can go every 12 months for lenses and frames. Frames, your copay is $12. And contact lenses is a maximum of $105. You can see your employee cost and deductions here below. Basic life, you are offered a policy that is paid for 100% by Scope. This is just a benefit to you, and God forbid, should something happen to you, you are insured for $50,000, which can help pay off some debts, maybe give you a nice funeral, or help your spouse or loved one a little bit by you not being there. Should it be an accident, that's an additional $50,000 benefit. So if you were to die in a car accident, for an example, your total benefit, the total death benefit is $100,000. You also have supplemental life insurance that's offered. So let's say that $50,000 is not enough for you, and you want to buy some more insurance. You can, and since Scope Management is a larger company, we can bundle all these rates together and get a better rate than you can outside of work, most likely. So you can buy in increments of $1,000 up to $100,000, and it's not to exceed 5 times your annual salary. You can also buy this for your spouse up to 50% of your elected amount. The minimum is $10,000 and the maximum is $5,000 for your spouse. So you can read through this, and then here are the costs. The cost is based on your age, and you can see there are age bands. Age bands do change from year to year, from plan year to year, not on your birthday. So there's a little bit of math involved, but if you need any help with that, feel free to call myself or Kim or Melissa. Long-term disability and short-term disability is also offered by Unum at no cost to you. So you're actually more likely to go out on disability during your employment years than you are to die during your employment years. So should you go out on short-term disability, something happens and you just can't go to work, the plan will pay 60% of your salary up to $1,000 for a weekly benefit. And this is after a 14-day elimination period. So roughly 2 weeks you would be on your own, but if you were still disabled after those 2 weeks, you would receive a check from Unum for a maximum of $1,000 a week. And the duration period is 11 weeks. And so let's say after 11 weeks you are still disabled, you will then be automatically enrolled into long-term disability. And that's still a 60% benefit, but now it has a monthly benefit of $60,000 or $6,000, excuse me. So it would roll right in from short-term disability to long-term disability, and if you were disabled until your normal Social Security retirement age, you would still receive a check from Unum, even if you were no longer employed at Scope Management. After this is going to be a bunch of Medicare notices, as well as more detailed information on all of these plans that are available to you. Like I said, should you have any questions, please just give us a call, and we will help you. We will help you with everything that we can. I understand that this is a quick turnaround, but we will get this done. And any questions you have, please feel free to contact us. Thank you for your time. I'm sorry, this is probably a little bit boring, but when I'm talking alone to my computer screen, it's hard to tell jokes. So thank you guys. My name again is Brent Young with the Freeman Agency, and I appreciate your time.